The second part of the book is sort of equally shocking for many people, which is I question the idea that all heart attacks are caused by blocked arteries. And that's something that we all sort of grew up on. We know that we have these three major coronary arteries that bring all the blood to our heart, or that's what we're told. And then we're told that something comes along to block the flow of the blood in these coronary arteries. Usually it's plaque, which is caused, we used to think, by cholesterol, and now we think it's inflammation. And the plaque builds up in one or more of these arteries and the blood can't get through. And then downhill from that, or downstream from that, the tissue dies of the heart because it doesn't get enough blood flow and oxygen. So that's what we grew up on. And basically almost 40 years ago, I started wondering whether that was correct. And there was some very simple reasoning that got me to question this. I, for instance, thought, so if there's something blocking, causing this plaque deposition in the arteries, it must be in the blood, obviously. And since it's also obvious that the blood is the same in the coronary arteries as it is in the liver and the spleen and your foot and the femoral artery and everywhere else, that those arteries must also get blocked, and then the blood flow can't get through there. And so we must have a lot of people having spleen attacks and liver attacks and foot attacks. However, after 10 years as an ER doctor and 30-some years as a general practice physician and giving literally scores of lectures and asking thousands of people, I have yet to find anybody who met anybody who had a spleen infarction or a spleen attack or a liver attack or a foot attack. And so that didn't make sense, that the only part of the body that had these attacks was the heart, and then secondarily the brain, which we call strokes. The second thing is, and more particularly since I've been treating people with heart disease, I would have so many people come to me with some variation of the following story. So I'm a 55-year-old guy and I'm basically in pretty good shape, and I went walking up Mount Tam and I started to get a little chest pain, and I didn't think much of it, but my wife got worried and she told me to go to the cardiologist, and they did some tests and they said I might have a blockage, and then they sent me to the cath lab, and then they found I had a 95% blockage in one of my major coronary arteries. And then usually they sort of wag their finger at them and say, if this blocks anymore, you're going to die of a heart attack. And of course that's a scary thing, and everybody gets worried about that. But I started to think, if the theory is correct that all the blood to our heart must go through these three coronary arteries, which is what we at least used to be told, then my first question was, how is it that this guy walked up the hill with 5% blood flow to a major area of his heart? Because that made no sense to me. And then the second thing that didn't make sense is I wondered, so if he blocks from, say, 5% down to 3% blood flow, so you mean that's going to kill him? And that made no sense to me either, because basically 5% is no blood flow, and the difference between 5 and 2 or 3% is nothing. And so that can't possibly be the explanation of why he has a heart attack. So those were sort of observations that I made along the way. And then somewhere around 10, 15 years ago, I read a book called The Pathoetiology or something like that of coronary artery disease. And you could actually find that book reprinted on a website called heartattacknew.com. That's all spelled out, heart and then attack and then new.com. And at the bottom of that, there's a print version. And a friend of mine, Knut Stroka, who runs that site, reprinted Baroldi's entire book. And this was an Italian pathologist who studied people who died of heart attacks for about 50 years, but he studied them with autopsy, which is really the best way to do it. And he came to the conclusion after this 50 years of study that exactly 41% of people who die of heart attacks have a significant blockage in the coronary artery leading to that part of the heart. And interestingly, he estimates that approximately 50% of the blockage come after the heart attack, not before. So if you do the math, that means 20% of the people who have heart attacks have a significant blockage in one or more of the coronary arteries, which of course means 80% don't. And so the question is, what in the heck happened to those other 80%? Now, interestingly, since the time that I published this book, the European Heart Association has come out with a new classification of why people have heart attacks. And the first, of course, is people who have atherosclerotic lesions in their coronary arteries. And the second is people who have heart disease with no evidence of any atherosclerosis. And they estimate that between 40 and 60% of people who have known heart disease have no evidence of any plaque. And then numbers 3, 4, and 5 are other things which are more minor. So European Heart Association says 40 to 60%, Baroldi says 60 to 80%. So it's somewhere around there, 60 to 80% probably, of people who have known heart disease, who actually have heart attacks, have no evidence of significant plaque buildup in their arteries. So again, the question is, what happened to them? Now, another clue to this is over the years there have been a number of studies, for instance the Courage study, and there's a few other ones, that looked at the benefits of stents and bypass surgery on people with blockages. And pretty much the consensus is, and actually the only thing that a cardiologist is allowed to say to a patient is, they don't, having stents or bypasses, which of course clear up the plaques, or at least that's what they say they do, don't improve the length of time that a person lives, and they don't prevent them from having further heart attacks. They only prevent or treat or mitigate chest pain. So that's the official line on the benefits or lack thereof of stents and bypasses. But then interestingly, in 2018, published in October in The Lancet, there was for the first time a study of stents where essentially they blinded the study. So they took half of the people who had one vessel blockage and they had significant angina or chest pain, and half of them they put a stent in, and the other half they put a catheter in, told them they put a stent in but didn't. And then 8 weeks later they evaluated them for the amount of chest pain they had, and they found the two groups had the exact same amount of chest pain. So they essentially disproved even the third benefit, so-called, of stents, which is that stents relieve chest pain. Now, the New York Times and the Atlantic both picked up this article and they ran it with the headlines that stents proven useless. And interestingly, they interviewed a cardiologist, and I saw this article about a week before I did an interview with Mercola on this. And a cardiologist from UCSF said, and I'll paraphrase here, these studies will help demonstrate to patients and clinicians that coronary artery disease or heart disease is a systemic disease, and the plaque buildup is only one minor factor that often doesn't need to be treated. And I can tell you that I almost fell off my chair when I read that, because I never remember a cardiologist saying to a patient, yeah, you have a bunch of plaque, don't worry about it, you really have some other disease, because I don't know what disease they're talking about. And so essentially this